If you have no symptoms, you may carry out your normal routine and boost your immune system. When you are outside, avoid public spaces and wear
is on.
Good afternoon and welcome to another NEOC, the National Emergency Operations Center, COVID-19 weekly briefing for the 18th of November 2020. We thank you very much as usual for joining us, being a part of what we are sharing here, so important in terms of the management of the COVID-19 pandemic here in St. Kitts and Nevis. And of course, as we continue to emphasize that it's an all-of-society approach. So we thank you very much for paying attention to what is happening here in St. Kitts and Nevis with respect to the virus and playing your important part in helping us to manage the virus. Anthony Fauci, the U.S. top epidemiologist, said that we are tired of the virus, but the virus is not tired of us. And we see that especially in places where there has been a resurge of the virus in Europe and in the United States, where the virus is running rampant. And so not because here in St. Kitts and Nevis we say that we have no active cases of the virus, we still have to be on our guard because, of course, the world itself is very, very small and our borders are open, and the very fact that people are coming in, there's always the possibility of the reintroduction of the virus into the Federation. So we must be mindful of that. I want to invite firstly, Superintendent Cromwell Henry, who is the Divisional Commander for District A and a member of the COVID-19 National Task Force, to give us the report with respect to law enforcement.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast by whatever means. As expected, the COVID-19 Control and Prevention Bill has been given its third reading in Parliament and passed into law. It now awaits the assent of His Excellency, the Governor-General, and publishing in the official gazette before it becomes effective. There were some amendments to the bill while it was in committee stage, and so at a subsequent briefing, I will highlight some of the provisions of this new act. We are still, however, guided by the provisions of the Emergency Powers Regulations, number 47 of 2020. We have been guided by these regulations for the last 7 months, and we do not expect or we do not anticipate any major changes with respect to expectations of our behavior in the context of COVID-19. Our borders are now open, and we have since received 2 international flights from major hotspot cities in the US. This means that our risk of exposure to the virus has increased significantly. All of the provisions and protocols in the various pieces of legislation that we are guided by are aimed at preventing the spread of the virus. Our entry protocols might be stringent, but necessarily so as to mitigate the risk of importation of the virus. And should the mitigation efforts not succeed, then our containment protocols, such as vacation in place and quarantine, and the COVID-19 certified transportation for visitors and returning nationals, should all act as a second layer filter to ensure containment. Notwithstanding these border control measures, we are all still required to follow the other basic protocols to protect ourselves. These are the wearing of face masks while in public, practicing good hand hygiene and sanitization habits, and avoiding crowded social gatherings, and maintaining a physical distance of 6 feet from other persons where possible. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Hazel Laws, our Chief Medical Officer for the Federation and a member of the COVID-19 National Task Force, to present us with the Health Emergency Operations Center Situation Report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center's Situation Report for today, November 18. And so we are all aware that St. Kitts and Nevis have only reported 19 confirmed cases to date. They've all recovered. Globally, based on the World Health Organization's dashboard, over 54 million persons have been confirmed with COVID-19, and the death toll has reached 1.3 million. I think between last week and now, there was almost 4 million persons added to this case count. In the United States of America, the total number of confirmed cases passed the 11 million mark last weekend. And in terms of the death toll, it stands at 248,707. What's happening in the Caribbean region? To date, there are over 282,000 confirmed cases, and the death toll continues to it's quite low, and it's now stands at 4,817. This just gives you an idea as to what's happening in the neighboring islands. In Jamaica, they have reported over 10,000 cases, Bahamas over 7,000, Trinidad and Tobago over 6,000, Guyana over 4,000, Belize almost 5,000, Barbados stands at 250 confirmed cases, Antigua and Barbuda, their case count stands at 134, St. Lucia it's now at 178. To be more specific, this gives you an idea as to what transpired within the last 14 days. And so within the last 2-week period in St. Lucia, they would have reported 81 new cases within the last 2-week period, bringing their total to 178. Dominica had reported 18 cases within the last 2-week period. Barbados 12 cases within the last 2 weeks, bringing their total to 150. And Antigua and Barbuda 6 cases, bringing their case count to 134. Here in St. Kitts and Nevis, our borders are open, and we continue to receive returning nationals and international travelers, tourists. And so today we would have tested, or we would have conducted as many as 3,554 tests to date. As you are aware, inbound passengers, meaning our returning nationals, our international travelers and tourists, some of them have opted to be quarantined and some have chosen to vacation in place, and so we have almost approximately 254 such individuals, and we have 4 individuals in pre-approved quarantine at home with Commission of Police prescribed security. All right, so ladies and gentlemen, I'm inviting you to actually log on to this website or URL, www.knatravelform.kn, and that brings you to the home page where you would find the entry form. So if you're thinking about traveling to the Federation of St. Kitts and Nevis at this time, we invite you to this website. You will be greeted by the health and travel protocols, which would guide your completing the entry form. All inbound passengers must complete this entry form, and you're also expected to take a RT-PCR test, a COVID test, within 3 days of travel. This test must be conducted at an accredited lab. At the end of the day, we really want the test to be, the report that you send to us to be authentic. All right, so that's why we're stipulating that it should be done at an accredited lab. Inbound travelers would be granted permission once you would have uploaded the negative COVID-19 PCR test report, once you would have provided us reservations, which you would have confirmed at one of the COVID-19 hotels, and once you would have submitted the various consent forms you would find on the site. And so it's very important to get that PCR test done within 3 days of travel, upload the report, and you really need to give us your hotel reservation. Please note that both the lab report or the lab test and your hotel reservation, they are verified before you are granted approval to enter the Federation. All right, and so there are persons who are presently vacationing in place, and they would have been here for over 7 days. They would have gotten their PCR test done at about day 7, day 8, and they now have the option to go on this Kittitian Highlights tour. And so this is the tour. This is the only tour that has been approved for phase 1 of our opening. And so individuals can opt to leave their hotel in a COVID-19 certified ground transport. Then the first stop would be at Timothy Hill, where you will remain in the vehicle and you can observe the peninsula. You can look at the Atlantic Ocean on the left and the Caribbean Sea on the right. And so after you would have left Timothy Hill, then you will be driven into Bastille, and then there is a restroom stop organized at Port Zante, and then you can circle Bastille and then observe the various historical sites in our beautiful town of Bastille. So I think you will, be able to see the circus, the Catholic Church, the Independence Square, etc. And then you would then be taken to the Brimstone Hill, the Gibraltar of the Caribbean, and then you head back to the hotel. And so for phase 1, the Kittitian Highlights tour, has been approved. Ladies and gentlemen, approximately 401 passengers would have arrived in the Federation between October 31st and the present. And so over this period, we would have received 401 inbound passengers, and just for transparency and completion, 405 persons would have departed the Federation. Please note that a significant proportion of these individuals would have come from the United States of America and the other source markets, including the United Kingdom and Canada. Okay, so as I said before, a significant proportion of these inbound passengers came from the United States of America and the other source markets, Canada and the United Kingdom. Many of the territories, countries who would have reopened their borders ahead of us, they are all experiencing a surge in the number of COVID-19 cases. And so it's very important that we note that it's just a matter of time for us in the Federation when our case count will increase. So I want us to pause and take note of this. Why is this so? Because right now here in St. Kitts we do not have any active cases. However, the virus is escalating around us. When you look at the neighboring islands and our source markets, they are seeing a surge in number of COVID-19 cases. Our borders are opened and persons are coming into the Federation from these territories. And so the risk of importing the COVID-19 virus is very high. In other words, we don't know if the virus has come in as yet. We don't know. We are not sure. It's going to be a matter of weeks before we find that out. And so I am imploring all of us to be very careful as we proceed, as we go into public spaces. We need to operate as though the virus is here. And there are steps that we can take to protect ourselves from the virus, and there are steps that you and I can take to prevent the spread of the virus if indeed it is here. So what can you and I do to protect ourselves from this virus? Wearing the face mask. This has been tested and proven. There are a number of persons who were in contact with, interacting with individuals who were positive, and just the fact that they had on a face mask protected them from the virus. So it works. So I'm imploring all of us to wear a face mask when in public places. Secondly, maintain hand hygiene. Make sure we make our hands remain clean. Good old soap and water, hand sanitizer, very, very important. So just in case you would have touched a contaminated surface infected with the virus, you would have cleaned your hands. Very, very important. Always maintain that safe distance of 6 feet between yourselves and others when in a public space. And we are being advised by Caribbean Public Health Agency, Pan American Health Organization, World Health Organization, avoid crowds. Avoid crowds. Avoid events with significant number of persons. Because you and I, we do not know if there is anyone who would be present in the crowd who may be a carrier of this virus. And so these are the steps that have helped others to protect themselves from the virus, and these are the steps that we do have at our disposal to utilize and employ to protect ourselves from this virus. These are the steps that can prevent a surge in the number of cases. I want us to be the exception in terms of reopening our borders without a surge in the number of cases. Wearing our face mask. Wear pretty face masks. That motivates me to wear mine. Just for additional information, there is yet another vaccine candidate on the horizon, Moderna's coronavirus vaccine. This announcement came earlier this week. They claim that it provides more than 90. They claim that it's more than 94% effective at preventing COVID-19. Apparently, two doses will be required. The vaccine requires very specific manufacturing and transportation conditions. And there's a quote from Pfizer's chief executive saying, and I quote, a great day. This is a great day for science and humanity. So at present, there are 2 known vaccine candidates for COVID-19. I would have shared this information last week. Last week, I highlighted the vaccine produced by Pfizer and BioNTech. Basically, this one also requires 2 doses, and the company provided us the assurance that they can provide a couple million doses by the end of this year. And of course, I must mention dengue. We are just coming out of a period of a lot of rain last week, and so it's our duty and our responsibility to walk around our homes and rid ourselves of breeding sites, the mosquito breeding sites in and around our homes. In other words, we need to empty and clean and dispose of all those containers holding water in and around our homes. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdias Samuel, who is the chair of the COVID-19 National Task Force and the National Disaster Coordinator, to give us his presentation. Mr. Samuel.
Good afternoon, Mr. Williams, and thank you for your introduction, and greetings to all who are watching via whatever means, and I welcome you to this briefing. Today I want to start my briefing by highlighting the request that was made by the Royal Caribbean Group, I think RCG, and in consultation with our many stakeholders, and also in consultation with the Cabinet of St. Kitts and Nevis has agreed to allow these 2 vessels to safe harbor at the Port Zante cruise pier. The Grandeur of the Seas and Rhapsody of the Seas will be safe harboring with no shore time being provided. What that means is no one will be disembarking the vessels. The vessels will be provisioned under strict protocols that have been set by our National COVID-19 Task Force and other stakeholders. So by next week, we should be seeing these ships safe harboring in our port. Again, I am appealing to citizens for calm, as in no way, shape, or form we will jeopardize the gains we have made in keeping St. Kitts and Nevis safe. So please understand that this is part and parcel of us opening up our borders in a very safe way and creating that balance between keeping us safe and economic activities. I want to highlight something to continue what Dr. Laws would have stated, is the inbound passengers that we are receiving. And to date, we have seen that on November 14th, we would have had 93 passengers that would have arrived on American Airlines Flight 318, and on Seabourn, 9 passengers. So therefore, the 120 passengers that would have arrived on the 14th of November specifically would have had 55 who would have arrived on American Airlines, 55 Americans, 40 nationals, 9 Canadians, and other nationalities. Nevis, Van Samuel International Airport, there were 8 arrival and 4 departures. 100 passengers would have departed on St. Kitts, 59 on American, 13 on Seabourn Airline, Winia, 17 Air Sunshine 4, Island Bird and SVG Air combined of 7 total passengers. This is very critical and very important because we have a couple days in which we will be testing the first commercial group that would have arrived in the Federation on the 7th. They will be tested on the 21st of November. Again, why is this critically important for us? It's because we don't know, and that's the reality, if we will get any cases from these passengers that would have arrived in the Federation. And again, I want to highlight what Dr. Laws would have said. These are the times when we have to do our best to avoid any large crowds, large gathering whatsoever. I want to also thank the taxi operators who would have come on board. We started with about 25, 28 thereabout, and to date we have now 39 certified taxi operators, 6 GT operators, or what we call safari or coasters, and in total we have 46 certified taxi operators. And Dr. Laws would have just highlighted that there will be tours that persons after testing negative on day 7, they can actually access these tours. We are appealing to the taxi operators to come on board and support the work of the National COVID-19 Task Force and the government by extension, so that we can create that balance between economic activities and combating the COVID-19 virus. I want to bring to your attention 2 critical incidents that would have occurred in St. Kitts last week, in particular on the 12th of November. We would have seen the landslide that would have occurred at the Fort Tyson Rise and Frigate Bay. And I want to thank the National Emergency Management Agency's response, which was led by the Deputy National Disaster Coordinator, Ms. Clarissa Langley-Stevens, and supported by the St. Kitts Nevis Fire and Rescue Services, the Royal St. Christopher Nevis Police Force, Defense Force, and also the Red Cross. Critically, I must highlight the Social and Community Development Permanent Secretary Janet Lewis for the work that they have done, but most importantly, our engineers from the Public Works Department and also physical planning. I think the effort that was made to respond to this incident was great. We will be having some meetings in short order to look at the recovery process. Most homeowners have been given approval to access their properties, those that are safe. Social services, along with other team members from our stakeholders group, have been reaching out to the homeowners so that they can return home. Those that can return safely can do so. We held a meeting with the homeowners on the 14th of November so that the homeowners would have had an opportunity to engage the investigative group led by Mr. Cromwell Williams from the Director of Public Works, and also present was the co-chair of the Mitigation Council, the Honorable Wendy Phipps, the ACP Adams from the Royal St. Christopher Nevis Police Force, and Permanent Secretary within Community and Social Development, Ms. Janet Lewis. And this was a very important meeting so that we could have positioned the homeowners to know what are the next steps going forward. Now, the meetings that are coming up is the recovery process, as the infrastructural impact that would have been suffered in that area needs to be looked at, and timelines provided in terms of how this project can be rebuilt. So I want to seek the patience of the homeowners and for them to continue to cooperate with us as we do our best to endeavor to bring you back to a sense of normalcy. I also want to highlight the island-wide power outage that would have occurred on Thursday, November the 12th, due to the localized fire at the electricity company at Needmust Power Plant. And I want to commend the work of the St. Kitts Nevis Fire and Rescue Services. However, we have to pay have to pay much gratitude to the Skelec workers who did their best to restore energy. Such an incident could have been more catastrophic to us here in St. Kitts and Nevis, in particular St. Kitts, bearing in mind that the majority of the population may not have had a generator to power their goods. So I'm thankful to the work done by Skelec and also the proactive approach by their media team and also their general manager and their management team. So again, thank you, Skelec, for the hard work that you put in to restore energy in St. Kitts and beyond. Now, I want to make an appeal to the business community because the Prime Minister would have indicated that there are going to be 2 discounted VAT days. So these 2 discounted VAT days will be the 18th and the 19th of December. So businesses and consumers are asked to adhere to the protocols, in particular the business places. I'm appealing to the business places to develop a plan. It will be critically important for you to develop a plan as per 1, sanitization, 2, the process of ingress and egress from your enterprise, your business. We also have to look at the security component of the business. How would you deal with traceability? Who comes in, who goes out? How long persons will remain inside of your enterprise or your business? And also, how do we safely carry out physical and social distancing? And equally so, how would you safeguard your staff, your workers during such a time? We know that some businesses will see some high volumes of persons entering their business for shopping, and as such, we have to limit this in some way. I'm asking everyone to reach out to the COVID-19 task force for assistance. However, develop a plan, bring your plan forward, and seek some advice. So I would encourage the development of rotation, a plan to ensure social and physical distance and reducing the crowded spaces. This is going to be very critical going forward. And also, I'm appealing to the consumers. You, the consumers, one of the discussions we had today with one of the major business places is persons who like to come in and just basically socialize rather than shop. And at this point, you have to take that responsibility in ensuring that you don't go there to socialize, but rather you go to do your business and leave. I want to highlight a challenge that we are facing right now is persons delivering items to individuals who are in quarantine. I want to appeal to persons to exercise the following. 1, the items must be packaged securely and properly labeled. The label should have the name of the person and the room number to which it has to be delivered. In order to curb why is this important? You might say, but why do we have to do this? One of the things we want to ensure is that the contrabands at quarantine sites are not imported. So the officers are asked to check all bags and containers or packaging that are brought to the quarantine site. We have seen where persons are actually getting aggressive. They are verbally insulting our quarantine officers. When officers simply ask to open the bag, let's see what's inside, so that not contraband goes into the quarantine site. I don't think they are asking you to do nothing out of the ordinary. I am simply appealing to all and asking all to cooperate with our officers. At this point in time, our prayers goes out to our colleagues in Central America as the passage of Hurricane Iota has impacted Honduras and as far as Belize, Guatemala, and the others in that region, Belize being a member of CARICOM. So our prayers goes to all those in that area. The weather for us here in St. Kitts and Nevis, tonight we will have partly cloudy skies with a 50% chance or moderate chance of showers, mainly before midnight. Winds at about 15 to 28 kilometers per hour or 8 to 15 knots. Seas not exceeding 5 feet. So the sunset for today is 5:35 p.m. and the sunrise tomorrow will be at 6:18. And before I leave here, I want to highlight something. Again, as I said to you before, pre-COVID, we used to say when, and people used to argue and say, Mr. Samuel, stop saying when, pray, you don't have no faith. And we used to always say when the virus arrives. Now we are telling you, since we have been impacted by the virus, now we are telling you our borders have opened and the virus will come. Let me give you a classic example. In Antigua on the 6th of November, a 58-year-old male would have arrived with a negative test to support some work that needed to be done at the power plant in Antigua. When he arrived in Antigua, he was negative. He was tested 5 days later, and he was found to be positive. During this time, he would have been interacting with all of his colleagues. He would have been training and working with to restore the power challenges that they were having in Antigua. Bear this in mind, that strict protocols were being followed, meaning persons were wearing gloves, they were wearing their masks, their face shields, they were doing their social distancing, physical distancing as much as possible. However, the individual who tested positive was isolated, and a few days later, he died. So he didn't even make it back out of Antigua alive. That's the reality and the dynamism of the virus. Why do I need to say this to you? Because we keep preaching about the protocols to you, the social distancing, the physical distancing, the hand hygiene, the wearing of masks, and ensuring that you have some form of traceability if needs be. Doing the different screening process, such as the temperature checks, which are critical. And persons keep fighting about the temperature checks, and Dr. Wilkinson did an extensive presentation here to speak about the temperature checks, which are critical, very critical. So therefore, I'm asking individuals to avoid mass gatherings. We need to avoid the mass gathering and exercise personal responsibility. If we do not exercise personal responsibility, St. Kitts and Nevis could become what some of our regional partners or regional islands are becoming, hotspots. Thank you.
Thank you very much, Mr. Samuel. That brings us to our question and answer, and we're always very happy to take your questions and very pleased to try to provide a response. The first question, there was a lot of talk on social media about $200,000 US paid by our federation to secure a vaccine. I also heard it discussed in Parliament yesterday. I remain totally confused about this payment. Dr. Wilkinson, can you explain in simple layman terms, COVAX, ACT Accelerator, Gavi, and the payment made so the average Joe like me can understand and be clear how we will benefit?
Thank you. That's fine. Okay. Very early in this pandemic, the World Health Organization realized that the only way we'll get out of this predicament is if we had an effective vaccine, and that's why so much focus has been on developing a vaccine. They also realized that this vaccine, if it was developed, it had to be available to every single nation around the world, and not just first world economically better off nations, because if these nations had a vaccine and they protected their population, but the low income countries were not protected because the world is so small and interconnected, they would have their risk increase. And so it was thought that if a vaccine was available, it had to be available, equitable to everyone across the globe. We also realized that there was a need to accelerate the development of testing for COVID-19, treatment for COVID-19, and the vaccine itself, and hence the ACT accelerator tool, or the Access to COVID-19 Accelerator Tool, ACT. So that's what that stands for. That was a global collaboration of major countries, scientists, philanthropists, etc., coming together to see how we can accelerate testing, etc., for COVID-19. Now, the COVAX facility, or COVID-19 vaccine facility, is the arm of that accelerator tool that deals with the development of the vaccine, separate from treatment and testing. And what the COVAX facility aims to do is to get countries to come together and pool their resources so that when a vaccine that is safe and effective becomes available, once they pool their financial resources together, they can make this vaccine available to every single nation across the globe. And there is a formula that they use, making sure that when this vaccine becomes available, each country would be able to immunize at least 20% of their population initially. And the aim of the COVAX is to have at least 2 million, I think it's over 2 million vaccines available by the end of next year. Now, St. Kitts and Nevis, along with most of the CAFA nations and along with a number of nations around the world, signed on to this COVID-19 facility, our COVAX facility. Now, it's not every country that would be able to pay. And so in this grouping, there are some persons who would pay, some will be funded, and some who would be exempt. And so our contribution, I think, was the $200,000 that you heard people speaking about on social media after the Prime Minister mentioned this at a gathering, I think, on the weekend. Now, Gavi, we mentioned this before under this setting, that's Global Alliance for Vaccine and Immunization, and that's a non-profit organization that has been around for almost 20 years, and that is an organization that involved in pooling or procuring vaccines on a global scale and distributing it to nations around the world. And they have been doing this for more than 20 years. They're responsible for distributing diphtheria, pertussis vaccine, etc. And so they will be the ones who will be distributing the vaccine that would be pooled through COVAX. And so I think it's a great thing that the Federation of St. Kitts and Nevis, like a number of other CAFA member states, signed on to the COVAX facility, because this will ensure that when a vaccine that is safe and effective becomes available, that we would have an equal share of the pie, just like any other first world nation, bearing in mind that each country will only get at least 20%. And so the questions that were being asked on the weekend too, well, who is going to get the vaccine? Is it just persons who have money, etc.? The vaccine will be given to those who need it first. And so those are the frontline workers, I guess healthcare workers, and the vulnerable, those, the elderly, people with pre-existing conditions. And as more vaccines come on board, then the rest of the population will be immunized so we can get herd immunity. I hope that explains it in the simplest of terms. Thank you.
Thank you, Dr. Wilkinson, for putting that in layman's terms. The second question, yesterday I heard in Parliament a discussion about the use of the terms social distancing and physical distancing. Can you define these terms and explain the difference between the two? Dr. Wilkinson.
Okay, I'll start with a simple one first. Physical distancing, and physical distancing, as it suggests, speaks about the distance between point A and point B. And so if we're asking people to physically distance in the context of COVID-19, we're asking them to stay at least 3 to 6 feet apart. Now, the management of this pandemic has been a rolling stone. Persons have had to readjust thinking, procedures, etc. And early on, the World Health Organization used the term social distancing, and they have realized their mistake and has since corrected it and changed it from social distancing to physical distancing, because social distancing suggests that there is some isolation between human beings, and we know that we have a need to connect. And so although we want persons to physically distance, we want them to still stay connected socially through the telephone, the television, etc. And so that is the main distance, because social distancing suggests there is isolation or no communication with another person, whereas physical distancing suggests separating at least 3 to 6 feet. So the correct terminology now is physical distancing. But if you were to read most of the articles early on in this pandemic, they would have been using social distancing, but the term has been replaced now to physical distancing.
Yeah. Is social distancing also avoiding crowds, avoiding large gatherings, large social gatherings? The fourth question: I am a national living in the Washington area and would like to come home. Myself, like many others I know, find it difficult to get a PCR test with results back in 72 hours to meet the requirements for travel. Can any consideration be given to extending it to 5 to 7 days? Dr. Laws.
That's a very good question, Mr. Williams, and I'll begin by saying that to date we have a number of persons or nationals would have returned from the Washington, D.C. area and would have provided us with RT-PCR test within the 72-hour period of travel. And so I think it just involves a little research. Persons have called and I've said, look, go onto Google. It's a very helpful tool. Plug in your address and Google the nearest accredited lab. And surprisingly, you will find a lab that can provide you that service. And we've been assured by the Pan American Health Organization's office that's located in Washington, D.C., that in the United States of America, it's a reasonable request, and most persons have been able to provide same. But I think I want to go the extra mile and explain the importance of this stipulation. And the science tells us that a RT-PCR test that's older than 3 days is of no use to anyone. Yeah? And we will be opening up the Federation to an increased risk of importing the virus if we were to go outside of this 72-hour window. And I think what's happening in our neighboring islands has underscored the importance of our adhering to that stipulation of having you give us a result of a test done within 72 hours of travel. Some of our neighboring islands, they were more lax. They said 5 to 7 days, and then now they are in community transmission. The virus is spreading like wildfire in those islands, and so it's a means of protecting our people that stipulation is a means of protecting us. If we accept a test that's older than 3 days, chances are there will be an increased risk of re-importing the virus. And so, regrettably right now, we are advising you to try your very best to, secure that service, whereby that lab can provide you the result within that 72-hour window. Thank you.
Thank you, Dr. Laws. The fifth question: some travelers come into the Federation by plane since our borders have been reopened, and they are being transported by taxis to the different seaports to travel across to the sister island, to Nevis. What is in place to ensure that they remain in a safe bubble between drop-off in St. Kitts and pick-up in Nevis? Mr. Samuel.
All right, thank you, Mr. Williams, for such a good question. All right, so here's what happens. So the traveler disembarks the aircrafts, goes through the entire process. When they reach outside of the airport, they are met by a dispatcher who will then channel them to the COVID-19 certified taxis. The COVID-19 certified taxis then takes them to that pier where they will be transported over into Nevis. Via the land and via the sea, all public transport are COVID-19 certified, meaning that they would have been trained, they would have done some retrofitting, and they would have employed the necessary protocols and procedures for these individuals. One such procedures is that no nationals who have been in St. Kitts, who are not international travelers, will travel on that particular vessel with the individuals. So these vessels are only transporting persons who have arrived in the Federation, otherwise known as international travelers. There we have environmental health officers, and we have a compliance team to ensure that the protocols are followed and there is no integrated mixing or interfacing between non-travelers and those who have just entered into our borders. Once they enter the vessel, then they go over to Nevis. On Nevis, the team on Nevis have similar organization there, whereby they are met by environmental health officers as well as compliance teams, and then they are ushered to COVID-19 certified ground transportation as well, and then these transportations take them to the place of abode. So there is absolutely no mixing between that corridor of transportation of those high risk, or what we call international travelers.
Thank you very much, Mr. Samuel. This next question: it has been announced that 800,000 EC dollars was paid down to buy vaccines. How many people would $800,000 provide vaccination for? Dr. Wilkinson.
Yeah, so what I said earlier is that formula was worked out for all nations so that their contribution would cover 20% of their population. And so if our population is 50,000, you can work out what 20% of 50,000 is. Yes, and it's a down payment. It's not the full payment. It's a down payment towards covering 20% of the population.
Thank you, Dr. Laws. Sorry, my apologies, Dr. Wilkinson. These questions are from Von Radio. Question for Superintendent Cromwell Henry. The Governor General mentioned during Tuesday's sitting of National Assembly that a decision was made to reduce the penalty for not wearing a mask from 500 EC dollars to 100 EC dollars. When will this come into effect? I will read them in one after the other. Also, if it is already in effect, why are so many people still seen without wearing masks, both in St. Kitts and Nevis? We have also observed that the majority of who wears the mask are wearing them under their chins, including police and traffic wardens. So what can you do for such a law to be taken seriously?
For some reason, our people only take things serious when there's a consequence. So hopefully once tickets are in place and are being issued, then persons will take it seriously. But we hope that it doesn't get to that. I mentioned in my presentation that the law has been passed, had its third reading, but there were some amendments to it in its committee stage. The reduction of the fine would have been one of those changes. I also said that those changes are being made now. The bill has to be sent to the Governor General for his assent, and then it would be published in the official gazette. Once that process is completed, then the minister would set a commencement date, as there's provision in it for commencement by the minister, and then it will be effective. Hopefully that will be shortly.
Thank you, Superintendent Henry. I can't mistake you have on a uniform. Okay, the last question for today. A recent article said that home testing for COVID-19 will soon be available. When would this be available in St. Kitts? Dr. Wilkinson.
Most of these home testing kits that they're speaking about refer to the antigen test, which we've said on many occasions that we would not be using that as our standard here. For now, we'll be using the PCR test, which is the gold standard, which is done in a laboratory. And so even if someone has access to the home testing, that might just be for their own peace of mind, but we have to understand that the sensitivity and the specificity of these tests, they are not that accurate. And lastly, I don't understand why Les White took me for Dr. Laws, but I will take up that with him after this program.
Dr. Wilkinson, that was a genuine mistake. I didn't think there was a gender change. Okay, that was our last question for the day. I want to thank Superintendent Cromwell Henry for his presentation, Dr. Laws, as usual, for her presentation, Mr. Samuel, Abdia Samuel, for his presentation, Dr. Wilkinson for always being here and answering questions, an important part of these briefings. I do want to thank AJ and Khalid from ZIZ for their faithfulness in coming each time we have briefing. They're the only faces as I am seeing nowadays, and I want to thank them for their faithfulness. And all of the media for continuing to partner with us in the work that we do here at the National Emergency Operations Center and the Health Emergency Operations Center. It is very important that the media plays a vital role in helping to spread the message in terms of what we are to do, responsible behavior, non-responsible behavior, and so on. I sure a lot of you are watching CNN and hearing what is going on. I don't even want to talk about that. But we thank also Mrs. Christmas Jacobs for her service of Sign Language. Thank you very much, Mrs. Jacobs, and thank you to all of you. And Vesta, of course, we thank you very much. We noticed that you're pole behind there. Thanks to everybody. Next week, we will see you for another NEOC COVID-19 weekly briefing. Until then, take good care, follow the measures and protocols, and we'll see next week. I am Les Roy Williams.